Hi there, my name is Chris and I'm with the British Columbia Lung Association. I'm sitting here with Angela Yao, who is an environmental health scientist at the BC CDC and also a PhD candidate at UBC. How are you doing?
I'm good, thank you.
Good. We're here to talk about what you're presenting today about, and that's AirCare. So let's get right into it. What was AirCare?
So AirCare was a vehicle inspection and maintenance program which ran between the year 1992 to 2014. It covered the entire lower mainland region, which include the greater Vancouver area stretching out into the Fraser Valley Regional District. And it was all under AirCare, all light-duty vehicle in the region was required to pass the AirCare emission test in order to be insurable. So the enforcement of AirCare is tied to your car insurance. And cars that failed the test had to be either repaired to meet a certain standard or to be removed totally from the road. So during this 22 years of the AirCare program, there were 3 different phases. In each of the phases, there were a different set of rules that are with regard to things like how often a car should be tested, or what kind of cars can be exempt from the test, and also the technologies used for the testing has changed over time.
So it's really intriguing stuff. But what was the impetus to having this program, and who was involved with implementing it?
As we know, motor vehicle emission is a very major source of air pollution in the region. For example, in 1990, when AirCare, right before AirCare was implemented, there's about 60% of the nitrogen oxides and 80% of carbon monoxide pollution in the region was actually from motor vehicle emission.
Wow.
Yeah, so the implementation of AirCare was aimed to reduce these air pollution from motor vehicle emission. And so by requiring the high polluting cars to be repaired, it does not only reduce emission by itself, it also gives incentives for owners to replace their old and polluting cars, and which will result in acceleration of the fleet turnover in the region to a cleaner, new cleaner cars.
That's great.
Yeah. And you also asked the organizations,
Yes,
that were involved. In this program, they were involved in different stages of the program. It includes the BC Ministry of Health, Environment Canada, Metro Vancouver, the Fraser Valley Regional District, TransLink, and because it is tied to our car insurance, so ICBC was also involved.
So Angela, let me ask you, why do you think it was important to study the impact of AirCare on public health, and what were the challenges in doing so?
Yeah, so as we just mentioned, the aim of AirCare was to reduce motor vehicle emission and improve air quality in the region. And this ultimately also is to improve population health by reducing their exposure to air pollution. So the impact on population health from AirCare should be a very important piece of evidence for this policy decisions, such as whether to end this program or not. So, but it has not really been assessed directly before, so that's why we conducted this study.
So I guess that leads me to the big question then. What was the impact of AirCare on our health?
There were a lot of challenges in the process of studying the public health impact of AirCare, because it is very difficult to single out the impact of a single policy in the midst of a wide range of other factors that are happening in the region in the past 22 years. For example, we have cleaner cars, and we have a big shift in demographic of the population, and we also have changes in lifestyle, such as smoking or physical activity. So all of these are also impacting public health in the region. So we have done some analysis trying to control for these time trends that's contributed by these other factors by controlling time trends in similar cities such as Victoria and Calgary. And we found that there was a decrease in cardiovascular mortality in the AirCare period compared with the period before AirCare was implemented. And this effect was especially robust during the very first phase of AirCare. And this is what we would expect to see, because during the very early years of AirCare, there were the highest number of high polluting cars got removed from the road. So we do expect to see the strongest effect during that period of time. And we also use some other more sophisticated statistical techniques, and we found that approximately 6,800 cardiovascular deaths were reduced by the 20 years of the AirCare program, which roughly translates into 1 death reduced per day of the program. So in conclusion, our study results thus suggest that AirCare is related to the reduction of cardiovascular mortality in the region, and such an effect is measurable. And I think public health impact assessments such as what we did in this study should actually be a routine for public health policy decisions that we made in order to make it really evidence-based.
That's excellent. I want to thank you for joining us.
Thank you, Chris.
See it?